This program is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about colon cancer, and joining me is Dr. Dwight Hardy. He's with the Mingo Valley Medical Group with Southcrest Hospital. Welcome to the program.
Well, thank you very much. I'm glad to be here.
Now, I am extremely pleased to have you here because colon cancer is something that we need to know a lot more about. But before we start, I always have a before we start.
Okay.
Tell our viewers about family medicine, family practice. What is it all about? Who do you treat? Tell us all the ins and outs.
Okay. Well, family practice, of course, is a very broad range of medical services. Physician is trained to handle probably 80% of the general things that happen to people during their lifetime. Traditionally, family practice doctors have performed lots of deliveries, taken care of newborns, and it basically it's birth to grave service for the entire family. Take care of the grandmother and handle everything from high blood pressure and diabetes, different kinds of fractures, office surgeries, simple things that you may not really need a specialist for. We actually think of family practice as being a specialty in and of itself, in as much as we're fully residency trained and are fully licensed in all states.
Okay, now with this, I think some people may wonder, is the family practice physician like what we used to hear being called the general practitioner?
Yes, but the technical difference is that a general practitioner doesn't necessarily have any residency training.
Okay.
He may finish medical school, do 1 year of rotating internship, and then come out into practice. A physician who is residency trained, board certified, does additional training in a family practice residency program and spends time in each of these different types of areas, such as surgery, obstetrics, internal medicine, intensive care, emergency medicine, those types of things.
Okay, so that would be a fair question if you don't have a physician and you're kind of shopping around and you would like to find someone who could take care of your whole family.
Right.
That would be a fair question to ask, you know, have you gone through a residency program and that type of thing, just for the average person to know.
And that's kind of the main focus of family practice, is trying to be the gatekeeper, so to speak. We talk about the medical home for a family. People can come to a family practice doc, become established, realize that the family practice doctor is going to handle the preponderance of health issues for that family, and that if there are things that are beyond the scope of what he or she does as a physician, knows the different doctors in the community and probably has a pretty good opinion as to who he thinks would handle this particular problem better than somebody else, a very specific specialist that he would want to send you to.
Okay, so they don't have to be afraid that you'll never get a referral to a specialist when you need one. It's just the opposite. You'll readily be referred when you need one.
Yeah, you basically try to be the patient's advocate.
Okay, okay.
And get patients through these doors.
Okay, excellent, excellent. Now let's look at our subject about the colon cancer, but before we do that, tell us a little bit about the colon, because many times we think we know about the colon, but we might be a little bit off. Tell us about the colon.
The colon, of course, is the same thing as the large intestine. People commonly hear about the small intestine, large intestine, but the colon is technically what is thought of as being the large intestine. And while it does have some role in absorption of certain nutrients, its main role is actually to take the material that we ingest. As it enters the large intestine, it's kind of a slurry, soupy mess. It absorbs fluid, and with that makes what we think of as being the bowel movement. And the main job of the colon is to reserve fluids, get fluids back into the system, nutrients back into the system, and then help us evacuate the waste products.
Okay, now with the colon then, when we're thinking about sort of the lifespan, your colon, of course, does it increase, and I'm going to talk a little bit about, because as a nation we're a little bit overweight as well. Does your colon, because people wonder about that, does your colon increase in size if you eat too much or you become overweight, or if you lose weight, does the colon shrink a little bit? I mean, is it affected at all?
Not really as far as the length of the colon. The colon does have a certain amount of fat that surrounds it. And this fat may, in somebody who's more heavy set, the fat may be more generous
Okay.
in somebody who's a little bit more heavy set than
Okay.
somebody who's skinny.
Okay, okay.
You
So
bet.
it's not affected as much as how it functions and that type of thing. 'Cause sometimes
Not really. It still does the same thing. You bet.
Okay. Now, when we think about the colon, before we get into some disease entities in that, what are some things that sort of help with colon health? You know, vitamins. I mean, we're a nation of we want to have vitamins, or we talk about eating our veggies, or don't drink too much soda pop, or, I mean, anything.
Well, it's kind of an interesting thing. Of course, our diet, the American diet, is a very highly purified and refined diet. We eat lots and lots of simple carbohydrates. This is kind of the white stuff out there, stuff like rice and potatoes and wheat bread, that type of stuff, very highly refined. We eat a large amount of animal fat in our diets. And the animal fats and large amounts of simple carbohydrates are some of the things that we believe actually that leads to ill health of the colon, leading to colon cancers. We know that certain societies throughout the world that eat more down the food chain, having more whole grains, roots, berries, those types of things, that colon cancer is and colon health is a much easier thing for them. They just don't get it like we do in the United States.
Well, would that also have something to do with even what we drink? Because sometimes as consumers, we want to think what we drink doesn't really matter as much as what we eat. But some things that we drink have a lot of sugary content to it.
Realize sugar is
All of
simple
those things.
carbohydrate.
Okay, all right, so
Okay,
get us back to
when,
that.
when we sit there and we talk about carbohydrates, carbohydrates are sugars, and there's 5 elemental sugars out there that
Okay.
our body occur naturally. Lactose, sucrose, maltose, fructose, and glucose. Glucose being the white table sugar that we think of. Well, these sugars are broken down very quickly into disaccharides, or little molecules that we know when you get a bunch of these things, a bunch of these sugars, it leads to ill health. It makes it more likely that you're going to have more of a problem, particularly in conjunction with a heavy fat diet.
Okay, so we need to realize these sugars are not just in the foods. That's why when I talk about our drinks, sometimes we think those are totally different creatures.
Right.
But it's affecting us the same kind of way what we drink as well.
You bet. And if we could somehow or another in the American diet teach people to eat better, eat more complex carbohydrates, more whole grains, try to lay off the white stuff, lay off the rice and the potatoes and the white flour things like the Danishes and the donuts and that type of deal.
Right.
People would do better, particularly if you can also at the same time minimize the amount of fat that is in the diet.
Let me ask this really quick question. We have to go to break. I think it's a quick one, Doctor. Vitamins. Are there certain kind of vitamins that help promote colon health? Like I said, we like vitamin A and C
I
and
tell
E
you,
and
there is
acidophilus and all those things.
certainly acidophilus helps with the digestion in the GI tract. Our society, of course, we have people who spend a large amount of their income in purchasing large amounts of mega vitamin this and vitamin that, and there are lots of proponents out there who would tell you that you need this and you need that in order to have colon health, and that you need to have different types of cleansing enemas and things along that line in order to have colon health. And really there's not a whole lot of scientific data to support a whole lot of that.
Okay, well, we'll take a really quick break and come back and focus on what happens that we get colon cancer.
Okay.
Please stay with us. We'll be right back.